show that there's 3 people here. Not me, you. Okay, cool. Okay. It is estimated that 80 to 90% of the population suffer from headaches at least sometime in their lives. It is the 8th most disabling illness in the world, with more than 90% of sufferers unable to work or do anything when a headache's occurring. So I want to talk about 3 main points today: symptoms of headaches, determining how headaches develop, and exploring the possible treatments for headaches. Knowing the symptoms of a headache can help us to understand what our body is experiencing to try and be able to address the pain in earlier stages of a headache. Although sometimes we may think it feels like our head is actually hurting and our brain is pulsating, the pain is not coming from there. Headaches can progress through 4 stages: prodrome, aura, headache, and postdrome. Prodrome, here you might notice symptoms 2 days before the headache occurs. Symptoms can include constipation, mood changes, food cravings, neck stiffness, increased thirst, and frequency yawning. The next stage is aura. Aura can occur before or during your headache. The symptoms to this stage can be difficulty speaking, hearing noises or music, weakness in muscles, vision loss, and a pin and needle feeling in your arms or legs. The meat of the headache happens third, and the symptoms can be pain on one side or both sides of your head, pulsating pain, sensitivity to light, vomiting, blurred vision, lightheadedness, and sometimes followed by fainting. No good. All right, the 4th stage is postdrome. The symptoms here can be confusion, moodiness, weakness, and dizziness. Now that we have examined the symptoms of a headache, we can determine how headaches are developed. Determining how headaches are developed helps us to understand what causes we can change or avoid preventing them from occurring. The first common type of a headache is a tension headache, which can be caused by many everyday factors, though we might not notice contribute to this type of headache. Under stress, the muscles of the head and neck often constrict, putting pressure on the nerves in this area. Certain things have been known to trigger tension headaches, such as stress, demanding schedules, worry, anxiety, depression, emotional upsets, anger, and posture and food allergies, alcohol and caffeine. The second common type of headache is a migraine headache, which usually results from a constriction of blood vessels in the skull. The most recurring reported migraine trigger factors included hunger, dehydration, stress, changes in routine, and hormonal changes in women. According to Catherine Berkner, who holds a PhD, she said migraines are most common in women. The third common type of headache is a cluster headache that are believed in common from stressful events and often plague those who have jobs where a high amount of danger and anxiety are present. The triggers of the other 2 headaches are also common with this type of headache. According to the Scholar article called Deciphering Cluster Headaches, researchers conclude that cluster headaches are more common in men. Now that we have determined how headaches are developed, we can explore possible treatments for these headaches. Exploring possible treatment options for common headaches can help us minimize the pain and quickly treat those headaches that are occurring. I want to start this section by saying taking aspirin to cure all headaches is not a recommended approach because different types of headache require different treatments. Tension headaches can be treated with not only medications like aspirin or ibuprofen, but also by alternative therapies such as meditation, a massage, stretches, or heat therapy. Migraine headaches can be treated in a variety of forms such as rest in a quiet dark room, massage, small amounts of caffeine, prescriptive medications, and also therapy using electrical currents to stimulate nerve cells in the brain. Cluster headaches can be treated by using treatments such as injectable medications, oxygen therapy, and preventative medications. It is important to know when to seek emergency treatment options for severe headaches. Conclusion. Sorry, I wasn't supposed to read that. Okay. Almost everyone gets headaches and most are nothing to worry about. But if headaches are disrupting your daily activity, work, school, or personal life, it is time to take action. I hope this helps you have a better understanding of the symptoms, development, and treatments for a headache so that you can take control when the next headache occurs.